Hi, I'm John Fiore, and this is Anya Gu, and we're physical therapists at Sapphire Physical Therapy in Missoula, Montana. We're going to introduce some exercises that are vital for runners. Exercise technique is the key for this video, so we're going to address some key points for each exercise we present to strengthen the glutes, the hip musculature, and the abdominals to prevent injuries in runners.
First exercise is the simple clamshell. This exercise is designed to isolate the gluteus medius musculature. Key points for the clamshell. John, go ahead and do a couple. Although it looks simple, the key points are: 1, you want to make sure your top hip stays down away from your shoulder. You can do this by thinking about creating just a small bit of space underneath your waist here so that your hip does not hike up as you do them. Second thing you want to be careful of is you want this gluteus medius muscle to be pointed essentially towards the ceiling. So instead of exactly stacking your hips, you want to slightly roll just a little bit forward so that your belly button is slightly angled towards the floor. The action is simply keeping your heels together and lifting your knee up towards the ceiling and back down. Try to keep your hamstring as relaxed as possible and lift using this back pocket area. Perform as many as it takes to start to feel fatigue in this region here. The progression of the clamshell is a slight variation, so if you can do a minute of clamshells and not really feel any fatigue in this area, you can move on to the second step. The setup is exactly the same, a little bit of space here, keeping that hip down away from your shoulder, but the action is starting with your knee up, keeping your heels together, and then alternating tapping your knee and then tapping your heel. Tapping your knee, tapping your heel. Keep a slight contraction of your lower abdominals to prevent any motion in your spine. And again, remember to keep that belly button slightly pointed towards the floor so that this back pocket region aims towards the ceiling.
The second exercise we're going to demonstrate is a side-lying hip abduction. Similar to the clamshell exercise, it also works to strengthen the gluteus medius muscle, which is located kind of right here in the top of the back pocket. Setup is key for this as well. The same lower hip, arching the torso slightly. And the position of the leg is key. Most people do side-lying hip abduction incorrectly in this plane of motion, where the hip flexor is actually working rather than the gluteus medius. The correct way is to be slightly forward with the pelvis, foot flat as if you're standing on it, extend slightly and lift up and back. It doesn't have to be a huge motion, but the muscle should be felt right in the back pocket as shown. The next exercise we're going to demonstrate is a hip bridge, and we have 3 variations of the hip bridge. Bridging, when you do a bridge, it's key to use your glute max muscles that extend the hip. You don't want to feel your low back arching or straining. You want to feel minimal hamstring contraction. So to do a bridge and a lift, and then hold this position. And once you can hold this position comfortably without the pelvis tipping right to left, then you can go to a single leg march, alternating right to left. And hold nice and slow movements. Good. Always going back to the bridge hold and making sure your pelvis doesn't drop. If it does drop or feel rotation, then you want to go back to the bridge hold. You don't want the rotation that way. And then finally, if that becomes doable for a minute, then you can go to a single leg bridge. Again, you tighten the glute, minimize the hamstring contraction, and lift the pelvis with one single leg, allowing the straightened leg to stay level with the height of the pelvis.
This next exercise is a series of lower abdominal activation and strengthening. It's really key while you're running to keep your lower abdominals contracted in order to stabilize your pelvis and better control your lower extremity. So not only while you're running, but also while you perform pretty much every other exercise that we are demonstrating here in these videos, you want to make sure this is contracted. So the first step is just contracting that lower abdominal muscle. You might see your pelvis tilt just a slight bit. So go ahead and hold that contraction. And then the actual exercise, you're going to bring one knee up, holding it there, bring the other knee up. And when you get to this position, you should not feel your pelvis tilt forward. Your back should stay flat on the mat. So the actual exercise is alternating tapping your heel down, back up, down, back up, while maintaining this lower abdominal contraction. If you can do this for a minute without any fatigue, you can move to the next step, which is same position, so bringing both knees up, but extending your leg out and then back, extending out and back. Again, trying to keep your pelvis from rotating as you do so, keeping your back flat on the mat, and trying to keep your six-pack muscle from actually pooching out and doing all of the work. We're trying to strengthen your transverse abdominis and oblique muscles, which are better at stabilizing that pelvis.
The next exercise we're going to demonstrate is quadruped, or on all fours, arm and leg elevation. And this builds on the last exercise for lower abdominals that was illustrated. The key here is to start not with a sway back, but a neutral spine where your lower abdominals are slightly contracted to stabilize your low back and your core. Next, Anya's going to lift her left arm as she lifts her right leg, avoiding any twisting or rotation and not letting this left pelvis drop down. And then alternate. Again, the hold of the exercise is important here. Rather than doing lots of fast reps, controlled movement and holding, stabilizing low back, abdominals, and hips. Next, we're going to show some ways not to do this exercise. Often we see some flaws in technique. Increase extension or lordosis in the spine, twisting, shoulder rotation. And all that can be corrected, first of all, by finding that neutral spine, lower abdominals engaged, glutes set, hips stable, and slow controlled movements, avoiding rotation in the spine. I hope you found this video useful and informative. If you have further questions regarding any of the exercises or other physical therapy related questions, please find us at our website at sapphirept.com. Thanks.